Today, let's talk about vaccine. What is a vaccine? A vaccine is a biological preparation that provides active acquired immunity to a particular infectious disease. A vaccine typically contains an agent that resembles a disease-causing microorganism and is often made from weakened or killed forms of the microbe, its toxins, or one of its surface proteins. The agent stimulates the body's immune system to recognize the agent as a threat, destroy it, and to further recognize and destroy any of the microorganisms associated with that agent that it may encounter in the future. Now let's understand what is vaccination. Vaccination is the most effective method of preventing infectious diseases. Widespread immunity due to vaccination is largely responsible for the worldwide eradication of smallpox and the restriction of diseases such as polio, measles, and tetanus from much of the world. The effectiveness of vaccination has been widely studied and verified. For example, vaccines that have proven effective include the influenza vaccine, the HPV vaccine, and the chickenpox vaccine. The World Health Organization, WHO, reports that licensed vaccines are currently available for 25 different preventable infections. The terms vaccine and vaccination are derived from variolae vaccinia, smallpox of the cow, the term devised by Edward Jenner to denote cowpox. In 1950s, parents were scared of the polio epidemics that occurred each summer. They kept their children away from swimming pools, sent them to stay with relatives in the country, and clamored for an understanding of the spread of polio. When the polio vaccine was licensed in 1955, the country celebrated, and Jonas Salk, its inventor, became an overnight hero. Historically, vaccines were deemed to be only for children. However, vaccines for adults are becoming increasingly common and necessary. Most adults think only of the tetanus booster recommended every 10 years, and even then, many adults only get the vaccine if they injure themselves. In 2005, the TDAP vaccine was licensed as an improved version of the typical tetanus booster, TD. The newer version also contains a component to protect against pertussis, whooping cough. All adults, especially those who are going to be around young infants, should get the TDAP vaccine. Adults often unwittingly pass pertussis to young infants for whom the disease can be fatal. In 2012, the CDC recommended that pregnant women get a dose of TDAP during each pregnancy between 27 and 36 weeks gestation. Influenza vaccines, available since the 1940s, are now recommended for most adults. Vaccines like MMR and chickenpox are recommended for adults who have not had the diseases. Unlike childhood vaccines, which are often required for entrance to schools, adult vaccines are not mandated. No requirements and a lack of preventive healthcare by most adults have led to low levels of vaccine use by adults.